Today I'm going to be talking about cholera. So, cholera is a bacterial infection that causes severe diarrhea and subsequently dehydration, and colonization of the infectious agent occurs in the small intestine generally. Some nicknames for cholera include blue death, black cholera, and rice water disease. And I included an illustration from the 1800s above to show kind of why it was known as blue death or black cholera. A lot of times the dehydration caused by the severe diarrhea and sometimes vomiting would cause patients to have like a bluish or grayish tint to their skin. So that's why it was known as blue death or black cholera. And then it was also known as rice water disease because the amount of water and mucus being lost by diarrhea would cause the diarrhea to sort of have like a cloudy hue that resembled water after it's been used to rinse rice. Or sometimes patients would have membrane from their GI tract in the bacteria, which would sort of look like grains of rice. But I didn't include an image of that, so don't worry. But annual US cases are very rare, and fatalities are often zero. But it continues to be a really serious problem in parts of Africa and Asia today. So the infectious agent is known as Vibrio cholerae. It's a gram-negative bacteria, and you can see sort of an illustration on the right. So it's comma-shaped with a polar flagellum, usually, and then it can have toxin co-regulated pilus, which is important for its ability to sort of latch on and colonize the cells of the small intestine. And there are actually many strains, but only 2 strains can cause serious disease in humans, and that's because those strains contain the cholera toxin, which I'll talk about more later. So as far as transmission, the biggest thing to know is that poor sanitation and a lack of clean drinking water are the biggest risk factors, and that's part of why we don't really hear about cholera today in the US, because we're really lucky to generally have access to clean water and good public health infrastructure and things like that. But typically what's going to happen is that people are going to contract it from the environment. So cholera survives really well in brackish water, which is like a mixture of like fresh and salt water, and it can form biofilms in the water. So what's going to happen usually is that someone will drink water that is contaminated, and then they'll develop the symptoms of cholera, and then a lot of times that will be released back into the environment through feces, and then it'll just create this positive feedback loop where more and more people are developing cholera, unfortunately. So high-risk populations, children under 5, older adults, immunocompromised individuals, people with type O blood, and then people with low stomach acid levels, which kind of makes sense if you think about it, because cholera, or Vibrio cholerae, has to get through the stomach to get to the small intestine. So if people have lower stomach acid levels, it's easier for that bacteria to survive and then colonize the small intestine. So the first recorded outbreak was in a Sanskrit medical text in 500 BC, describing an epidemic in India. And India is a big place for cholera, and part of the reason for that is there are just a lot of factors that make it a good like breeding ground for cholera. So brackish water, there's also monsoons, which can cause like floods, which can contaminate other water sources. It's densely populated, and there was trade coming out of India, things like that. So multiple pandemics have begun in India. The first one began in India in 1817 and spread globally. And then the third, which I mentioned because I'll talk about it later, ended up spreading to London. And then in 1854, Filippo Pacini in Florence was the first to correctly identify the bacterium causing the disease. But it wasn't till Robert Koch identified it a few years later that it became more broadly accepted by the scientific community. And then going back to that third pandemic in London. So to talk for a minute about John Snow. John Snow was a London physician in the 1850s, and he is often known as the father of epidemiology. So London in the 1850s was really overcrowded and dirty. Their population had increased exponentially, but they didn't really have the infrastructure or the housing to support that. So in this image, you can see an 1860s London slum. So there were slums, overflowing cesspools, and contaminated water. Charles Dickens actually described the Thames, I hope I'm pronouncing that right, like a famous river in London, as a deadly sewer. So it was super dirty, and disease was suspected a lot of times to come from miasma, which is kind of like bad air. And there are actually reports, I don't remember if it was in London, but there are reports of people in the 1800s firing sulfur into the air because they thought maybe the sulfur would clean the air of disease and cholera. So they didn't really know what was going on. So John Snow begins investigating and mapping cholera outbreaks, and he particularly looks into these cases occurring into the London neighborhood of Soho. And he realizes all the victims are drinking water from the same pump. Now you can see like the actual map that he created here, and all the cases are clustering around the pump. There were only 2 cases that were kind of far from that water pump, and it turns out those victims were getting water from that pump because it was their favorite water. Which is really unfortunate because it turns out that there was a cesspool leaking contaminated water into the pump. So once he realizes that, he eventually convinces people to get the pump handle removed, and the outbreak stops. And then this was a really big deal because not only did he kind of become the father of epidemiology, but it fueled a lot of public infrastructure changes in London. So they eventually started getting better public infrastructure, better sanitation, cleaner water, and things like that. And if you go to Soho today, you can actually see the pump that he traced the cases back to, and it has a plaque now. Going into pathogenesis, so it's going to happen with V. cholerae is it colonizes the lining of the small intestine with help of toxin co-regulated pilus, which I talked about earlier. And then the 2 most dangerous strains for humans, O1 and O139, have the cholera toxin, as I mentioned. And that's where the problem really starts. So the cholera toxin, or CT, will enter the epithelial cells in the small intestine, and it's going to increase the production of cyclic AMP, or CAMP. So then what's going to happen is the chloride ions are going to leave the cells and enter the lumen, and because those chloride ions are leaving the cells, they're going to be followed by a lot of sodium and water, and that's what's going to cause that really severe watery diarrhea and then subsequent electrolyte loss. So interestingly enough, 60 to 75% of those infected will remain asymptomatic. Part of the reason that scientists suspect this is because in order to get to your small intestine, V. cholera has to outcompete your healthy natural gut microbiota. So it has to compete with them for room and for nutrients and things like that, resources. But for those that unfortunately do experience symptoms, they're typically going to emerge 2 to 3 days after exposure. But symptoms can emerge faster, within hours, or not for up to 5 days. And typically what it's going to initially look like is stomach cramps and then maybe some vomiting, followed by diarrhea. And I don't think people realize how severe the fluid loss is. It's really just water that you end up losing. So you can lose up to 1 liter per hour. And I believe I read a stat that said you can lose anywhere from 10 to 20 liters within 24 hours, which is insane because that's 20% of your water in your body, I think. So it's really crazy, and that's really what causes people to die from it. So as far as immune response, it is a non-invasive pathogen, which I kind of touched on. So it's not going to cause huge systemic problems unless the dehydration causes other issues. But so it's not getting into the bloodstream or anything like that. It generally stays, the V. cholerae stays in the small intestine. So the immune response is going to occur there. And then you'll have your typical initial innate immune response. And then you'll have a humoral adaptive immune response. So the antigens that the body's going to recognize are cholera toxin and OSP, or O-specific polysaccharide, which I show both here. And then the IgM, IgA, and IgG antibodies will respond to it. And then initially, another thing to know is that the CD4 plus T helper cells will help with B cell maturation, which will mean that if you get infected with cholera again after contracting it, your body will recognize it, and people generally have immunity from anywhere, I want to say from 3 to 5 years. So if you contract cholera, you can be immune for years after that. And then as far as prevention and eradication, so there is a maintenance of an oral cholera vaccine stockpile, or OCV stockpile, but there are issues with distribution and just meeting demand. And then another really big thing that I'll talk about more in a second is educating communities on the WASH method, which stands for safe water access, sanitation, and hygiene. And then there's also Ending Cholera, a Global Roadmap to 2030 project, and that seeks to reduce cholera deaths by 90% by 2030 and to completely eliminate cholera in at least 20 countries. And then as far as eradication, when unfortunately there are outbreaks, if prevention doesn't work, early detection is a really big thing, because if you can catch it early, you can stop it from spreading into the environment and affecting other people. And then containment of outbreaks, and then coordination of global and local efforts. So this is something that we see UNICEF or USAID working to fight, but then also local public health efforts are a really big deal. So coordinating those are a good way to work on eradication. And then as far as treatment, so rehydration therapy is the most common treatment because, as I mentioned before, dehydration is really what will kill you. So for people that have less severe cases, that usually look like oral rehydration solutions, you can kind of think of that just like Gatorade. So there's going to be some salt and sugar and water, and that's just really useful for getting those electrolytes back in your body and getting some water in you. And then for people that maybe can't keep anything down or are really severely dehydrated, they might get IV fluids and sometimes antibiotics in a hospital. And then interestingly, zinc supplements are also recommended for children. I looked into this and it seems like they're recommended for kids with a lot of diarrheal diseases, and it prevents the severity and the duration of the diarrhea and the amount of water loss that's being like released out of those like epithelial cells. So it can definitely help with that. And children typically have lower zinc levels, which I think is part of why it's typically just recommended for children. And then I included this infographic just because it's interesting. So if you're ever in a situation where you're really dehydrated and you need like an ORS solution, it's really just generally like drinking water and then, salt and sugar, and you stir it. And that's what this man is doing here, is creating ORS solution at a cholera rehydration station. Although typically they would come in like pre-made packets. As far as current events, unfortunately, although we don't really feel it here in the US, cases have more than doubled over the past 3 years, and there are a few reasons for that. So vaccine shortages, climate change, conflict, poor sanitation, limited public health infrastructure, and mass displacement are all causing an increase in cholera. Part of the reason for this increase in cholera deaths is likely due to the impact of USAID cuts. So in the past year, a lot of preventative public health programs like WASH, as well as local health clinics, have become endangered due to USAID cuts. And part of the reason for this is that a lot of non-life-saving measures have been cut. But unfortunately, just because WASH is preventative doesn't mean that it's not life-saving. And there was a really sad story in the New York Times that I included just as an example. These victims, there were a couple adults and then a few children, I believe, who ended up dying on a 3-hour walk to try to reach a public health clinic because the local ones near them had closed due to USAID cuts. And so they ended up dying of dehydration due to cholera on the way to the next clinic. So it is like the cuts, USAID cuts do have really real effects for cholera, especially. I think it depends on the disease, but cholera is one that is hit really hard by these cuts in funding. And additionally, a $2.6 billion USAID grant for Gavi, which is a vaccine supplier, was cut, which has decreased their ability to provide oral cholera vaccines. And typically we're going to see, according to the WHO, about 1.3 to 4 million cases per year, anywhere from 21,000 to 143,000 deaths. So it does vary a lot, but still a lot of deaths regardless. And then about 31 countries currently are reporting cases, although that may have changed since I looked up those stats. But didn't want to end it on a sad note, so some reasons for hope. With proper treatment, 99% of patients can survive, and that's a huge deal. If we think back to the London cholera outbreak in John Snow's time, if people were showing cholera symptoms, obviously people could be asymptomatic, but if they were showing symptoms, there's a good chance that 1 in 2 people would die. And now with treatment, 99% of people can survive. And the oral rehydration serum, or ORS, costs less than 50 cents a person according to UNICEF. So again, it's really easy to make and supply, and that is huge in saving people's lives. Many countries have eliminated the disease entirely. Again, like across Europe and North America generally, there aren't cholera outbreaks anymore, and as well as parts of Asia, so like Japan has eliminated cholera as well. Clean water is becoming more accessible globally. That isn't to say that it's not a huge issue, because it still is, but it is increasingly becoming more accessible, which is awesome. And so finally, no one really has to die of cholera anymore. When people die of cholera, it's not usually due to a lack of understanding in the scientific community. More so, it has to do with people not having the right public health infrastructure, public sanitation, and access to clean water, which is sad, but also really great that we know how to help people with cholera. So, thank you for your time.